Welcome. You are watching episode 27 of Mobility Talks, the web series by EIT Urban Mobility. In this episode, we will be discussing how urban mobility planning can reduce air and noise pollution in cities. What was captured for eternity in the paintings of Turner, Monet, or Pissarro were the cities of the Industrial Revolution, where coal-powered factories and transport were pouring nitrogen oxides, sulfur oxide, smoke, and other particulates into the air. Gradually, an increasing population density in cities was coupled with the development of individual fuel-based modes of transport as the car was democratized. This led to vehicular emissions from urban mobility to become an extra source of air pollutants, contributing to what is commonly known as smog, or London's fog, which is only the visible part of air pollution. Only this week, the European Environment Agency released a report showing that 97% of the urban population in Europe is exposed to unsafe levels of air pollution, and nearly 240,000 deaths are attributed annually to exposure to air pollutant concentrations. This report comes as the revised EU Air Quality Directive entered into force yesterday, introducing a 2030 target for new air quality standards aligned with WHO recommendations. But there's also the problem of noise pollution. As I was saying, there's also the problem of noise pollution. The EEA data shows that 20% of the EU population lives in areas where noise levels are harmful to health. Unfortunately, we've become all too familiar with the warning signs of peak pollution in our cities, which usually leads to temporary measures in relation to traffic management, for instance. But in this episode, we will be exploring the more transformative actions that cities can undertake to create healthy environments for citizens to thrive in. Of course, it's not all about urban mobility, but urban mobility can also play an important role both in terms of reducing the number of pollutants, but also in encouraging active forms of mobility that give you a little bit of energy. So, before I introduce our guest speakers today, let me first introduce you to yourselves. You were close to 100 to register for today's session with participants from 32 different countries. A warm welcome to you all. And we also have a good representation from the public and private sector, all looking, I am sure, for good solutions to be implemented. As usual, I encourage you to get involved in the chat and Q&A. I'll be raising your questions and comments with our speakers. So, to get us started, I will first turn to Amber Delahaye. Amber is lead of the Healthy Cities Lab, and she will be giving us some ideas as to how cities can better be informed about their choices and their decisions and the impact of those decisions on their citizens' health. Amber, over to you.
Hi, thank you for having me. So my name is Amber and I'm in charge of research and product development at Healthy Cities. And we're a startup based in Barcelona. We're made up of architects, urban planners, and experts, and we aim to help cities center health in urban planning projects and policies. And so we do this because up to 90% of our health comes from outside of the hospital space, from your behavior, from your environment, from the air you breathe and the noise you listen to. Easy access to green space, for example, within 300 meters can reduce asthma rates by a third. And building walkable cities that help people get their steps in can reduce premature mortality by up to 11%. And then all of this has knock-on effects, significant effects on healthcare costs and reducing the cost on our healthcare systems. So to address this, we work across three main pillars. At Healthy Cities, we have the Healthy Cities Lab. And so this includes research into the links between health and urban planning, producing guidelines, such as a recent guide for integrating health into transport planning that we made for ATM, Barcelona's Transport Authority, and training programs for municipalities. In Healthy Cities Action, we directly work on health impact assessments, GIS analysis, urban designs with a health perspective. And finally, we also have built a tool, the Healthy Cities Generator, a Healthy Cities tool, which is designed to support healthy urban planning and to make it easy for urban planners and for municipalities to integrate health through their urban projects. So I just want to focus a bit on the Healthy Cities tool today, as we have very recently launched the tool 2.0 thanks to an EIT Urban Mobility Innovation Project. The Healthy Cities tool is digital. It's designed to be easy to use, flexible in different contexts and across different types of urban and mobility planning projects. And it's based on an evidence base, which includes a systematic literature review, finding the links between health and the urban environment. And also a review this year by the University of Lisbon that found the average cost of the health outcomes that are linked to the urban environment and to what degree these health outcomes can be affected by the built environment itself. So via this research, we identified 20 urban determinants across categories like quality urban streetscapes, varied neighborhoods, good connections to where people need to go, including good cycling infrastructure, walkability, street connectivity, reduced traffic speed and volume. And these are linked to 30 health indicators. And so that includes health determinants such as air pollution and physical activity, which we know to be very closely linked to health outcomes, and also direct physical and mental health outcomes from obesity to diabetes to depression. And so essentially the model shows that if you make improvements to these elements of the urban environment, then you're going to have a positive impact on these elements of health. So how does the Healthy Cities tool actually work? There's 3 main steps to the tool. First, the user assesses the baseline status, which helps the tool indicate which urban areas you should prioritize to meet your specific health goals. Then you can review your urban plan, identifying how impactful your actions are going to be on the various health indicators that you're interested in working on. And then finally, in the results as well, you can see how much you would save on health costs each year and the overall health impact of your urban changes or your mobility plan. So for a bit more detail, first we ask for contextual information about your area, including your health goals and an assessment of your area's baseline. So this is really useful to help identify your priorities because, for example, a neighborhood with an elderly population concerned with the risk of loneliness and with falls needs a different urban intervention to one with a wealthy population struggling with stress and lots of traffic. Likewise, the baseline assessment helps ensure that the recommendations are targeted to your needs. Let's say your health goals mean that you need to increase cyclability, but you already have a great bike network in your city. So your need for this will be reduced, and the tool in this way takes into account your existing strengths and weaknesses. Next up, you review your urban plan or your mobility plan to see how impactful it will be on the 30 health outcomes. The tool will tell you to what extent your plan is tackling the priorities that you discovered in the first step, and you can compare different actions to see which is more impactful and which is more relevant to your specific needs. And it's important to say here that the assessment is subjective. We know that 100 meters of bike lane has a very different impact in Amsterdam than it does in Barcelona. So we provide questions to help the user determine how impactful each action is going to be within their specific context. And then that means the tool is flexible and adaptable to different countries and contexts. So you could use it in a street redevelopment or a citywide master plan. And then finally, you get to see the results, which include insights on health improvements, estimated savings for the whole plan. And here you can also compare 2 iterations of the same plan with slight differences alongside comparing the different actions that make up your plan. And then this helps the user prioritize actions or prioritize a plan and make decisions. And then finally, we also create an attractive, easy to understand PDF report with the key information included so that you can share the outcomes, the predicted impact on health, the predicted impact on cost savings with decision makers or with residents or with other stakeholders. So I just want to share an example of the tool in action. We recently applied it to a large highway development plan in Bradford, which is a city in the north of England. with high health inequality. And so it's quite a deprived area. It's struggling with poor birth outcomes, low emotional well-being, air pollution, stress, social interaction issues. And the project is really valuable. It's transforming the entire city centre, replacing major roads with better pedestrian and cycling connections, and significantly more diverse green space. So applying the Healthy Cities tool here showed that the plan was going to have really positive health outcomes, suggesting savings of around €700 per person each year. Interestingly, it showed that actually the greening element of the plan was going to be the most impactful, and that was not the original focus of the plan. The original focus was pedestrianisation and connection between these streets for cyclists and pedestrians. So the tool is really useful for showing the impact on health and on economic savings of often overlooked elements of the built environment, such as green space. And it's also useful for judging the proposals of external consultants to ensure they meet the health requirements of the city. So this tool is online and available to use now. The basic functionalities of health analysis are free, so anyone can use it. And then the full set of features with the economic outcomes and expert consultation from our architects is a subscription. And in addition to the tool, we also support municipalities and private entities by using it ourselves for analysis and training users in the tool, as well as expanding it, helping interpret the results, doing workshops with citizens using the tool. And then outside the tool, we also have a range of other services to support mobility and urban planning departments, with workshops, trainings, creating strategies and urban plans, etc. So that is everything from me. So I think I went a little bit over my time, and you can find out more on our website.
Perfect. Thank you. Thank you so much, Amber. You weren't so much above your time. No worries. Maybe just one question to understand some of the background of the tool itself. I mean, obviously there are lots of variables in there, and you mentioned how complex it can be to attribute certain values between cities in different contexts. What kind of sort of, let's say, basic research is the tool based on? Is there like a kind of some sort of research that the tool has built upon?
Yeah, so the tool is based on multiple systematic reviews of the literature, and the literature is basically showing a connection between these urban elements and health outcomes. So the literature shows that improving cyclability, improving cycling infrastructure, the safety of cycling infrastructure leads to improvements in diabetes, cardiovascular outcomes, physical activity, anxiety. So this is the kind of research that the tool is based on. We're not looking so much in detail into the specific meters of bike lanes that are required to achieve a percentage of reduction in cardiovascular diseases, because that creates this need for so much data and specificity. What we wanted to create was we have these links. We know these elements of the urban environment are linked to health improvements, and this means that you can use the tool and it can be quite quick. You don't have to enter lots of data, and you get a general idea, an indication of the direction you're taking. Not so specific, but you don't need months or even years of research like you would to get the data-driven answer.
Yeah, it gives a easy to use tool which gives you very good indications, and also what you mentioned what was quite interesting is how much you can then share some of these results with a community as well. I thought that was quite interesting. Maybe that's something we can get into also in the discussion. Okay, brilliant. Thanks, Amber. Then next up for a second case study as well is Claudia Lacasta. She is Smart Cities business developer at Libelium. And I understand this is all about giving information, right? Real-time, live information to cities about what is going on and what are the health effects of what is going on. Claudia, please, over to you.
Thank you. Thank you, Jean-Paul, for having us. Thank you for giving us the time to explain a little bit our tool, which is Enver 360. And it was developed under one European project, and then we saw the potential, and we try to replicate it in more countries and in more cities all around Europe. So this tool gets inside one of our platforms. But before getting into it, let me just explain a little bit more about Libelium. We are an IoT company that we are very much in contact with our clients, with our usually public entities, public municipalities, local agents, but also companies that are very much doing things to adapt to climate change, to be more resilient, to adapt the services that they are providing. And being this close to them has also impact in our activity, because we are shifting from being only an IoT manufacturers and producers here in Spain, but also to be providers or complete solutions. So going from doing the entire scope from hardware but also software. So, sorry. Yeah. So the tool that I wanted to present you is, as I mentioned, Enver 360, and it appear like we all know the impact of low emission zones. We know that there's directives about it. We know that the European Union it's very strict about them. But I don't know if all of the countries that have presence here in this seminar today, but at least in Spain, it's something that it has not been implemented that much. So we are seeing cities that are implementing their low emission zone, but then some, because of legal issues, they are taken away. We also have other cities that should implement a low emission zone, but they are not implementing them because they consider that there are so many technical issues, or that they say that their city is not polluted. And we are seeing that even though there is a mandate to implement it, they are not doing that. So in this particular case, we from Libelium, we try to adapt the development that we did for a European project to this specific software, Enver 360, that integrates very large amount of data already available in the city, but also we are using open source data, like for example, noise data, information about traffic, if the city has already cameras installed, and so on. And we are implementing different algorithmic models. So we are using, for example, Street Canyon, we are using Munich, we are using Chimere to try to understand the city like very locally, and try to understand how other things are impacting in the pollution of the city. So for example, it's not the same if a city it has a lot of mountains surrounded, or if for example we are close to the sea, so we have the impact as well from the sea and those air currents. So all of that we are trying to take it into account to really make a very real simulation, the digital twin of the air quality in a city. So it's based on fiber, and we are, as I mentioned, integrating all type of data. Also, I will then show it to you like how it's implemented visually. But to make an idea, this tool we are aiming to be implemented in 3 different agents, let's say, in cities. As I mentioned, to implement low emission zones. So, for example, we saw that in Barcelona, I think, they implemented a low emission zone, and they determined the area of the low emission zone where they wanted to put the restrictions. But apparently, it was based on not real. There was no real evidence that implementing their measures will reduce the pollution in that area. What we want to do is try to help the cities, saying, okay, you have this specific area where you are having problems, maybe because it's an easy access to the highway, or maybe it's because you need some roundabouts in here, and to try to disperse the traffic here. We try to really understand why we are having heat islands in the city, etc. Then, as we also see, for example, in Barcelona or in other cities with ports, they are acting like like other cities. I mean, they have roads, they have areas that are very much polluted, they have a very high activity, but they are not legislated by the same laws that in cities, but they need to coexist. So what we want to do is, using this micro scale model, try to also understand how pollution is moving and it's working in ports. And same things in the highways. We have as well done some projects in highways in the Basque Country here in Spain, and we try to understand how the pollution, how traffic it's impacting nearby areas in the highways. So that's why we believe that this tool could be beneficial to these three actors. And now a bit more technical, how the Enver 360 tool is working. So as I mentioned, we will be gathering data, all type of data. Basically, we don't really need to have devices, IoT devices, to monitor the state of the air quality, because we will be taking into account, for example, if the city already has some information about that. But information about the traffic, cameras, noise, super important as well, because we are trying to also map how the noise is impacting the areas, and it's very much related to a low emission zone. Then we will do the model implementation, as I mentioned again, to try to understand how weather, for example, it's impacting the pollution, how it's moving in the area, how we need to tackle certain specific points to reduce pollution. Then we will be using artificial intelligence to simulate different scenarios, and we will implement possible restrictions. So we will, right now we are working with the restrictions that the European Union is establishing for a low emission zone. And right now there are 10. So for example, limiting access to only residents, limiting the entry hours to delivery services, and so on. And we will be seeing in this digital twin how the air quality in a certain area will be improving or not with these measures. And I say or not because sometimes and I'm sure we will talk about that today, pollution it's not only coming from traffic. There's industries nearby, there are ports, for example, as well, and we really need to see how they are impacting the overall air quality in the city. So this tool also allows that. Maybe we don't need to be super restrictive with a low emission zone because pollution is not coming from traffic. So yeah, and then of course verification. This is a work in progress. We are always retrieving more information. We are always validating the data that we are putting into the mobile to make sure that everything is up to date. Here you have some representation. This is a real case that we have done in Cartagena, in the southeast of Spain, where we deployed air quality devices, and then we also did this visual representation. So here we have how visually it's impacting NO2 in different areas of the city with a heat map. We can see that clearly roundabouts are very polluted, but also Cartagena specifically has a very unique case because they have the impact from the port, but also they have some mountains behind the city, so all the pollution is getting gathered within it. And then we can see here how applying some simulation in a specific area, we will be seeing some improvements in the overall air quality. Of course, here we can work with relative scale, normal scale, and so on. But again, this will permit the local authorities and the local responsibles from the traffic to make accurate decisions. And here, well, we can see some, again, some information comparison, like how it was before and how the air quality is after implementing some measures. Yeah, I don't want to be over time, and I think I already passed that. But yeah, so as a conclusion, just say that from Libelium, we are always very aware that having data and being able to take decisions according to data and based on real case scenarios. It's super important. This allows the cities and municipalities to reduce money, to really allocate the funding to effective measures to the objective that they have. If in this case it's reducing pollution, they will be able to do so. And yeah, well, thank you very much. Of course, if you have any more questions, feel free to ask during this hour or so. And yeah, happy to be here.
Perfect. Thank you. Thank you so much, Claudia. Maybe a quick question for you, because you mentioned that cities don't need to put in place specific devices. So you're working with, let's say, existing data from different sources. I mean, that sounds actually quite challenging, because usually there's a lot of complications in putting lots of different data sources together in terms of interoperability of the data and things like that. Do you come across certain challenges between data sets, especially with such different variables as you might get across noise and air pollution? Is that a bit of a challenge?
I mean, it's always a challenge to work with different technologies. The good thing is that from the beginning, Libelium has been an open source company. We have worked with fiber from lots of years now, and we are very used to work with different technologies. And at the end, being able to integrate and also make use of the technology already deployed. We don't just want to cover the city with devices monitoring the same things. We want to really use what there's already there and try to make it valuable. I think there is an statistics that said that there are, I don't know, that we only use like 13% of all the data gathered because it's not being put to use. So what we want to do with this tool is to really make something about it, like to use it, work with it, integrate it with other information, other data, and really put it to use and get the indicators and the information that we need to make to put into place effective measures.
Okay, thank you so much. So I think we can really get started with our conversation. I would also like to apologize for Piotr Kuropatwiński, a senior expert at the Polish Union for Active Mobility. Unfortunately, he was not able to connect with us today. He sends his apologies. But we have two very interesting case studies, and we can go a little bit deeper into the topic. It's a very broad topic, as Claudia just mentioned. It's not just about urban mobility, and it's already probably quite difficult to understand the specific share of urban mobility in noise and air pollution compared to other sources. But I'd like to start with the pollutants first, right? I'd like to start there. And if we go down to the level of urban mobility, is it as simple as to say, if you get rid of cars, okay, basically, if you get rid of cars, are you going to make a very, very, very big impact on reducing, especially air pollution, probably noise as well in cities? Does it get as simple as that? Amber?
I think it's air and noise pollution is only one part of the puzzle here as well. I think as well as the issue not just being about cars, I think we need to look beyond air and noise pollution as the only issue with cars, because there's also many other direct health effects from the car-centric cities that create this noise and air pollution. So you've got, for example, exposure to motor traffic noise and main roads affects children's cognitive development and leads to an increase in attention deficit disorders. So I think rather than just thinking cars equals air pollution equals noise pollution, we need to think there's so many other issues here. There's so many other problems with this form of design, other health problems and other knock-on effects of this as well. The mobility systems that lead to this air and noise pollution in cities are also connected to increases in obesity, in diabetes, to people feeling unsafe on the streets, to sedentary behavior, not being able to access locations, increases depression, social isolation, reducing cyclability and walkability, increases average levels of BMI. It's even linked to poor birth outcomes. So I think there's so many knock-on effects that we need to include in this analysis as well. And it's not as simple as just getting rid of cars. You need to design a city where the cars themselves become superfluous to tackle all of those additional knock-on effects. Because if you're just moving the cars from one area to another, you're just moving the problem. And also, if you're getting rid of cars without putting in alternatives, without putting in different modes of transport or encouraging this modal shift to active mobility and also to just less mobility, less need to move around the city, you're going to get a lot of pushback from residents who are feeling their lifestyles are being affected. So I think I'm very impressed by the results of Libelium's tool and this possibility to identify the most effective interventions. But I would also argue that it's important not just to differentiate how much of noise and air pollution comes from cars or from ports or from airports, but also to look at the wider benefits of making the changes that will improve well-being, improve health, improve livability of cities, with the knock-on effect of reducing air and noise pollution, but the additional effects of promoting general well-being. There's a nice fact that improved public transport reduces the risk of depression. So being closer to a bus stop can actually reduce your chance of suffering from depression, especially for women and especially for older people, because it increases the opportunities you have for socializing. So I think whilst air and noise pollution and cars are inevitable within a city, we can design ways to mitigate them, and those methods can also have positive impacts on all other elements of the city and of health.
So cars do remain a central part of the equation, but I think what you mentioned also about displacing cars from one area to another is also interesting. I mean, if you are going to close off, let's say, an area to cars, but then they just get displaced to another area, that's not necessarily solving the problem. Claudia, maybe also a comment on that. I mean, I know that nothing comes in urban mobility, but surely there must be some kind of simple solution by just saying, let's get rid of cars somehow.
I mean, something that Amber mentioned and you brought up again, it's that we just don't want to close an area and move traffic to other area. I mean, at the end, we will be putting other neighborhoods under more pollution, and that's not really what we want to do. At the end, what we want to do is to be able to reduce it. Cars are not the only element and component of urban mobility. We also have public buses, delivery vehicles, taxis, and of course service fleets that are contributing to the essential mobility and at the end are producing emissions. So we, as a city, we really need to be able to tackle all of those. I mean, closing the roads and forbidding cars to getting into an area will definitely not solve the problem. Again, what I think it's that getting more information, emission tracing, being able to understand via advanced analytics or maybe machine learning as well, from where the pollution is coming, being able to differentiate diesel fumes from ships, from vehicles, will allow us to make, and not us, but the city, the ones that need to make these decisions, to really make decisions based on real information. For that, investment on digital infrastructure, sensor deployment, and so on, it's also super important. But again, not remain only on the surface. As Amber was mentioning, there is much more to pollution than just the environmental things, but how it's impacting us as social beings, like how it's impacting our health, how the city would benefit from having more healthy citizens. I think it's very much important.
Yeah, and we'll definitely try and get into the more active parts as well of urban mobility. Maybe just very one direct question for you, Claudia: is your tool available for trying? I mean, is it an easy access just to give it a try?
Yeah, definitely. I mean, any company, anybody interested, or municipality can contact us, and we will be more than happy to prepare a demo for them. We are already doing that. We are presenting our tool to some of them, and also we are presenting it to public tenders, trying to 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 find our place in the market. And yeah, we are doing these demos, showing how it will benefit the city. Mhm.
And for Amber as well, I mean, how easy access is it for a city to give it a try?
Go straight to our website, Healthy Cities. You can find us on Google, and you can trial the tool right there. So it's available online already.
Okay, so easily accessible to give a try. That's just it's a question from the audience, so I thought it'd be important to raise it. The other angle that I'd like to explore with you, and you already mentioned, Claudia, all these forms of mobility, right? We haven't even necessarily talked about logistics, but that was one of them that you mentioned. Is there, in any case, regardless of what we're able to do, is there in any case a basic level of noise and air pollutants that will always be associated with the simple, very fact of having a form of urban mobility? I mean, is that something that is basically inseparable from the fact of having to move around? Claudia, what do you think?
Yes, I mean, even if we shift everybody to electric vehicles, for example, we will still be having the pollution from the how can I say it? The brakes and the
Yeah.
tires. So at the end, a certain level of particles will always be in the environment, and also noise. I mean, noise from the cars, from public transportation, from the citizens. I think that's inevitable. Mhm.
Okay. Amber, do you see it as something inevitable?
I think maybe I'm a little bit more optimistic than Claudia on this. Yes, it's inevitable when you live in a city. It's one of the trade-offs of the incredible vibrancy of living in a city, that you're going to have noise, and you are going to have living on top of one another, that there are going to be impacts. But I do think we have been accustomed to accepting a certain level of pollution that we should not accept. I don't think we should feel like we need to accept breathing in air that is dangerous for us. And part of that is why I think it's very important to move towards systems that change the need for mobility as well. It's not just shifting mobility modes, but reducing the need for mobility. So if you have, and a certain amount of air and noise pollution is always going to be inevitable, but to mitigate it to levels that are within healthy levels, we need to create neighborhoods where everything you need is accessible within the neighborhood, on foot or on bike, to really reduce the use of vehicles, even electric vehicles, to the absolute minimum. Because, as Claudia points out, that even electric vehicles, even the braking, even the tires of vehicles do have a certain amount of pollution. So yeah, it's not just shifting away from high traffic, but also shifting away from the need to move so much that will have the long-term impact on reducing this pollution.
There's a question in the chat which I hope I understand in the following way, because obviously we're talking about context, and urban mobility, as we've mentioned already, is a part of a broader context of things that happen in cities. And one thing that happens usually in cities are big events. So there's a kind of a temporary occurrence of events of any kind. I mean, it could be concerts or big shows or strikes or all sorts of things that happen in cities, and how much that also affects the general analysis that you can make on health impacts. Sometimes I imagine that might be quite difficult to calculate, because they're punctual. event. So would you have any way, maybe through your tools, to somehow cater for this kind of thing that typically does happen in cities? Sorry, maybe Amber first.
I think this would be a place for Claudia's tool to shine. I think what we're looking at is more the general urban environment rather than specific events, but it sounds like Libelium might be the answer to this.
Claudia.
Okay. Well, it will always vary of the event. If, for example, it's something that happens every year, we will be much more able to monitor that. We will be able to anticipate. We will be able to really understand how the year after impacted and how can we, as a city, take measures to make it less impactful this year, and being able to understand how everything worked to make improvements. At the end, machine learning and artificial intelligence will allow us to do so. Then, if, for example, we only want to monitor a certain event happening this year. For example, Taylor Swift concerts in Madrid were a problem these past months because they were doing them in the city center, and neighbors were complaining a lot because they were not used to that noise. It was not only the concert itself, but the people afterwards and before that, and it had a truly impact on their lives. That, of course, we will be able to monitor that, but to be able to do so, you as a city need to already have a deployment there, being able to have the tools to be able to monitor those noises, and being able to take measures if certain levels are above the what's normal or what it's livable. We, for example, in Zaragoza, again, in there is a pedestrian street, very big, lots of stores and bars, and there was also a concern there about the noise levels being above the usual, especially in local festivities and also in Christmas. So what they did there was to deploy the device plus LED light, so it will turn red in case the level of noise was above a certain level. I'm not sure if it was a national regulation establishing these levels or it was a local one, but this was allowing the citizens to see that the noise was very high. And maybe if you see a red light saying maybe, okay, maybe you are shouting, and you automatically it makes you reduce a little bit your voice, and if everybody does that, the overall noise gets lower. But yeah, for that you also need to have tools, and you already need to be able to identify this concern, because otherwise if the event happen and you are not prepared for that and to be able to monitor it, it will pass by and you will not get that data. I don't know if I had answered the question, sorry.
I think you gave it a try. I mean, it's probably not such an easy one to answer, and maybe Amber as well on the behavior change side of your tool. I would like to be to push you a little bit, because there is an interesting aspect to this, which is the punctual nature of an event, and how much you can use that as some sort of case study to show the breadth of possible health outcomes that would happen out of a very specific, let's say, mobility pattern around a big event, whereas on the other hand, the way you describe your tool, I see it's more sort of a long-term view, so would you see some kind of a role of using very punctual events as case studies to basically to create more awareness and potentially then behavior change as well?
Yeah, I think it's an interesting idea. Like you said, our tool is more designed for understanding a baseline of health, a form of design that encourages people to behave in healthy ways, and for the urban environment to facilitate healthy behavior and also just general health. But you'd think that an ideally planned city in this way should also be able to handle a large event better than a city that doesn't have so much capacity. When you're privileging active mobility, I think a nice example would be to think about the Green Access project in Barcelona. We did a health impact analysis of this project. It's to replace a selection of major roads through the center of the city with pacified pedestrian roads with green spaces, benches, people can cycle through them. If you think about how much more capacity there is in those streets for people to flow from a major event in the city centre through shopping on Christmas, for example, on foot and on bicycle, than there would be if everyone was driving to the same location. Then you can think that building in this way from a health point to start with is going to facilitate a healthier system that can handle these kind of flows better.
And Amber, what do you think in general is driving cities to do more in this area? I mean, in trying to improve noise and air pollution levels. I mean, I mentioned in my introduction, you know, the air quality directive. So there is a legislative framework. But is that the main driver, or is there also something coming from very direct public pressure in the sense that there is an understanding and awareness of the problem, and cities are just trying to respond to that? What do you think is the main driver in your experience and your contacts with cities through the development of your tool?
In my experience, the driver is more legislative than from public pressure. There often isn't as much understanding as there could be, I think, amongst residents and communities on the impacts of the urban environment on health, which I actually think is really important to increase that awareness as well, because it can be very controversial to remove a parking space from citizens. It can be a very controversial thing to go in and say, we're going to reduce your parking, we're going to replace it with a bike lane, we're going to replace it with some trees. But I think when you go in and you talk about the importance of health for this, you talk about why this is going to have a direct positive impact on the community, you can get more of a push from the public, and you can bring the public on board. And I think a simple way for the public to understand that the benefits are going to impact them is important. But I think both are there. It's carrot and stick, definitely.
But it's true that there is a kind of an expectation when you live in a city that you have to accept, you know, a certain level of pollution. I mean, otherwise you'd be living in the countryside kind of thing, and that trade-off is probably quite deeply ingrained, you know, in our approach. Claudia, what do you think? I mean, in your contact with cities, do you feel it's really like the legislation that's pushing, or there is at least some form of public pressure as well?
I think there is a mix of both. Usually, I mean, you can always find cities that really understand there's a problem in the air quality in the city, maybe because there's industries nearby or they have really identified the problem. But there are other cities that they just want to comply with the regulation, and they don't want to face any fine, for example, and they just want to make check and say, okay, I have implemented my low emission zone, but I'm doing the bare minimum, right? Then again, we also have cities that they have heard a little bit more of their citizens. They are, I think, us as citizens, we are much more aware of the impact of this pollution in our health. As Amber was mentioning, it has very big impact in our health, like mental health, how it's impacting our daily life, and that it's true. We have assumed that there is always going to be a certain level of pollution, and sometimes we are okay with that, but we shouldn't. I mean, we should ask our politicals to make something about that. Working with other countries in Europe, other cities, we are also seeing some movements, community initiatives, and you see that their local governments are doing things because their communities are asking them for. Like, for example, having more bicycle lanes. Everything started a little bit with Fridays for Future, and we saw how that was impactful and how important was to really put a name to something that was a reality. People was using their bike to go to work, and they really needed that bicycle lane. So I think we still have like a long way to go and um, to make cities implement these measures only because they want to truly benefit their citizens. But in this case, I'm going to be more optimistic than Amber, and I will say that yeah, they want to do it for the citizens.
Okay, and on that note, I mean, let's also be a little bit positive, okay? Because we've been talking about getting rid of stuff, but what can we also actually do, what cities can do to actually have a positive effect also on health? And you've all mentioned bits and pieces of that already. So in a similar question to, is it as simple as getting rid of cars? Is it as simple as just getting more people to have active forms of mobility, whether that could be cycling or walking especially? I mean, is that the main kind of urban mobility factor that can actually have a positive health outcome for people? Or are there other elements that you think are really important? I mean, you mentioned also, the green spaces, avoiding heat islands and things like that. Amber, you also mentioned, I think, the impact of public transport on a broader level. It would just be interesting to hear you a little bit on, is it as simple as just getting people to go on a bicycle and walk? Or is there more to it? Amber?
Yeah, I mean, obviously air and noise pollution are connected to so many elements of the city, and they can be impacted by so many different design choices. So it's not just switching to public transport, but all of the other elements. So you've got increased population density, improving the connectivity of the streets, improving the walkability, the accessibility of public open spaces, ensuring there is effective green coverage and not just lots of green spaces, but that the planting is diverse and that the spaces are connected and of high quality and continuous throughout the cities. So it's not just changing the modal shift from cars to public transport and walking, but a full approach of redesigning a city in a way that facilitates that. Because when you have a dense neighborhood with all of the services you need, people will walk to the shops and they will run into their neighbor on the way, and they will feel a sense of belonging and social connection, which improve their anxiety, their depression, their sense of well-being and happiness, their feeling of safety as they see other people on the street. So I think putting in place urban designs that encourage a shift to walking and cycling is so much more than just saying, right, we're going to have more walking and cycling. You need shade for the summer to encourage walking and biking all year round. And there's a compound effect on the health and habit changes there. It's not just about reducing the pollution from traffic, but also mitigating the pollution that is left over from essential traffic with green spaces. And then the knock-on effect is that people are more active, they're less stressed, there's reduced cardiovascular diseases, the list goes on. And public transport is, of course, an important part of the mix. And it also needs to be considered carefully. So it needs to be designed to mitigate noise and to have additional benefits. For example, adding green substrate underneath tram lines to reduce the noise of the tram and capture pollution, and also improve the aesthetic image of the area, which improves people's mental health. So yeah, there's so much more you can do with streets in terms of changing the mobility network than the actual moment of moving people from A to B. But all of it is part of encouraging that change in mobility, and all of it has so many knock-on effects. And something I've not mentioned so much so far, but I think is really key, is the impact then on healthcare costs as well. So this Green Axis project that I mentioned before, greening these major roads, IS Global did a study that suggested that this is leading to a 45 million euro reduction in healthcare costs each year. And I think that was just from mental health costs, but from having this highly trafficked, highly stressful, highly noisy area and creating this calm oasis within it. So yeah, it's so much bigger than that.
And Claudia, I mean, obviously your tool will be highlighting the negatives, right? By showing heat maps and things like that of where things are going wrong. Inversely, how much are you able to show what's going well, and how maybe active forms of mobility or other planning decisions in relation to urban mobility can actually have a positive effect on health?
I can talk only about the tool, but there's much more. The tool is able to be adjustable and to really understand the specific situation of the city where it's implemented. So if, for example, there would be a plan to build certain bike lanes or gardens or parks in the area, or we want to make it pedestrian, certain streets, the tool will be able to take all of that into account. So, for example, if you want to implement a park of, I don't know, 100 square meters in this specific area, we will be able to, via artificial intelligence, understand how it will impact on the traffic, on the air quality in that specific area, but also in the overall air quality of the city. So at the end, as we are able to adjust it very locally, hyper local, we are able to make those changes and really see the benefits of the things that the city wants to do.
Okay, perfect. Thanks for that. I think maybe it would be interesting to take a look at a poll that EIT Urban Mobility put on LinkedIn to the community. What's most urgently needed to reduce air and noise pollution in cities? There were 4 options: better pollution monitoring, stricter access regulations, more electric vehicles, and the one that was the most voted, the shift to public transport. So the shift to public transport for the community, followed by stricter access regulations, would be the most urgent measures required in cities to address noise and air pollution. My question to you both is, do you agree with that assessment? Amber?
Yeah, I mean, I think if we're including cycling and walking as public transport, which would be a stretch, I would agree with that. I think in practical terms, the most important change you can make in your city to reduce air and noise pollution is to reduce traffic and increasing the amount of people taking public transport or just out of private cars, redistributing the space to people, bikes, public transport, essential delivery drivers, is key to that. But it's also key to ensure that the change meets people's actual needs. Are there children? Then there need to be areas for play. Are there elderly people? Then you need to put in regular benches. Do you have sufficient lighting for people to feel safe walking to the bus stop at night? There's no one-size-fits-all approach. And I think if you try to push people into public transport without actually meeting their needs, then you're just going to create an angry population. So in a very dense city like Barcelona, we need more public space, more greenery, more quiet, more tranquility. But in a spread out, greener city, you need more transport connections, a better density of services and people, encouraging people to live their daily lives in their neighborhood by ensuring services are available. So the first step, and this is what we do with our tool, is to understand the needs of the city, what the city baseline is, what the health needs are. And then the second step is design an intervention that works to address those needs. So if that's increasing public transport, then that's increasing public transport. But I think in Barcelona, a city with at least in the city centre, very, very rich public transport connections, it wouldn't be the number one thing that was needed. It wouldn't be the best use of increased public space that would potentially be taken away from cars. Instead, there's other needs of the city. So yeah, I think identifying the needs is the most crucial thing. A good example is when we worked with the Barcelona government on La Industrial, so it's redeveloping a city block in the center of the city. And the assumption from the local government was that what people needed here was to conduct more physical activity. So they wanted to put in exercise equipment. But then our analysis showed that actually this is an area with high economic social status. They work out a lot, they go to the gym, they go hiking on the weekends, but they're very stressed and they have high rates of cardiovascular disease. So our model recommended that there needs to be a reduction in the speed and volume of traffic in these streets, and in the new space that is opened up by reducing the cars, more greenery, because that leads to improved mental health. So yeah, I definitely don't think this is a bad idea, but I think you need to think about the area that you're in before making the right intervention.
Yeah, there's not just one carpet solution. Claudia, what would be your reaction then to the poll? Would you also consider the shift to public transport? And I think we can add in walking and cycling in there. I think that would be fair. Would you see that as the biggest factor that cities can actually work on?
I mean, if people voted that, I assume there's a certain concern about that. But for me, being able to understand the problem, you need to get the data for that. I mean, just as Amber was saying, just there is no one fits all. To make the shift to public transportation, you also need to improve the frequency. You need to make it accessible to everybody, and of course, it's not the same if we are working in a city center like you are talking about Barcelona. But for example, us that we have we have one office in Murcia. Lots of people are moving from a small villages nearby to the city center. There is no public transportation for that. So maybe you are able to, once you get into the city, you can move in public transport, but there is no one alternative to get to the city. There is no intermobility. You also need to get, for example, from the train station to the bus station. If you want to only use public transportation, there is no multimodal alternatives. So I think it needs to be more understandable on the environment that we are talking about. For us, of course, once a city has all the data that they can get to make more database decisions, the better. That's the only way for us that a city can truly make an impact and take measures that will really benefit the citizens. But of course, public transport, I understand it's a concern. But again, I don't think it fits all the needs and all the realities people in a city are living.
Yeah, I mean, I think the data has two functions in what you're saying. I mean, there's the information, but then there's also the awareness that it creates within a community in the kind of dialogue you need when you are taking urban planning decisions and decisions affecting people's very immediate lives and surroundings and neighborhoods. And Amber, you mentioned how there are some communication aspects of the tool that can be very useful for communities, I guess local communities. Can you just maybe, I don't know, through an example or give a sense of how communities can take ownership of some of those measures, some of those data points, and that creates a support then for positive change in neighborhoods?
Yeah, I think it's really essential to bring the community along with you. Consultation and connection with residents is so key if you're going to be making these changes. And centering health in conversations with residents is a great way to increase the acceptance of moving to a healthier mobility system, but it needs to be introduced in an accessible way. We run workshops using our methodology where we go out into the city with residents with a name. So you could be Candela, who's a 80-year-old woman from the neighborhood, and she needs to pick up her prescription, and she needs to see her friend. She needs to do a little bit of shopping, and she wants to have a sit down and a rest on a bench on the way. And you take a kind of checklist of elements. You take a walker, and you try and go about Candela's day for an hour to really understand the accessibility needs. Like, was there a place to sit down? Was I able to get the walker up into the market? How far did I have to walk to buy all of these essential goods? Did I see people along the way? Were the views nice? Was the pavement good quality, or were there trip hazards on the way? So to be able to do an exercise like this and then come back and work with this was done in Hospitalet in Barcelona, for example, and or just outside of Barcelona, and to be able to then come back and work with the municipality to suggest the changes that you think this area needs after you've seen through the eyes of a potential resident. And after you've seen through the eyes of the different needs of the different kinds of residents in this area, I think really helps people think about what their dream neighborhood could look like. And I think another thing that's important about bringing people on board, I think especially if you're talking about removing cars without putting in alternatives, you're going to get a lot of pushback. We've seen in cities like Oxford in the UK, it's almost it's been described as even a civil war between drivers, between motorists and the municipality who are trying to make these changes there, because there's been so much pushback, and a lot of that has come from a feeling that there wasn't enough consultation when introducing low traffic neighborhoods, when reducing car access to certain areas. And I think there's also a feeling often amongst residents, there can be a feeling that these kind of measures can target people from lower socioeconomic backgrounds, especially low emission zones, maybe people who can't afford newer cars, then feel like they're unfairly targeted. I think Barcelona did quite a good scheme with that, where if you traded in your car that didn't fit with the low emission zone, you could get a year or 2 years of free public transport access around the city in exchange, which is a nice way of softening the blow and also encouraging that shift. But I think it's also really important in the communication to stress that air pollution, the heat island effect, noise pollution is most prevalent in deprived areas. It affects women, elderly people, younger people, and poorer people more. These are the people who are more likely to be walking and using public transport. And so despite often a lot of noise made by a privileged minority, really you're tackling inequality, you're tackling health inequality by putting in these measures. And I think that's a really important message, and something that communities can also take up and center in their push for healthier mobility options.
Yeah, it's really this combination of information on planning, but then also information for citizens to better understand the impacts and to have extra information themselves. And I think that opens very interesting pathways for local debate in communities around change. Maybe one for Claudia coming from the chat on whether it's something that could be easily replicated. I don't know if there are any case studies or temporary measures, pilot projects that could be worked on in highly densely populated cities, such as, for instance, Delhi or Bangalore in India. Specifically, these examples are mentioned in the chat. And I'm thinking with the tool that you have, I mean, as you are based on, let's say, existing infrastructure, hardware, devices, etc., how replicable could it be in cities like that?
So the model allows to get information per 5 square meters. So at the end, we are getting data very hyperlocal. Regarding the technology, of course, we are prompt to use technology already deployed. But for example, if we really want to monitor a certain area and there is no information or enough information to create a model that will provide the accurate data to take measures on, we will recommend to implement devices. At the end, we will implement some air quality devices to monitor the air quality in that area. And I mean, at the end, depending on the area to be covered and so on, we will need to put more or less. Maybe we are only implementing these devices to complement other data sources. So we really work in that case very how can I say it, case by case. So we do that consultancy part, like understanding the place, the needs, why they want to do this project, and how to implement it. In Delhi, we submitted a proposal to do people crowd monitoring because of religious tourism and things like that, and we are going to work in a scenario like that, overly crowded population, not very narrow streets, the roads are not very limited. There is also different types of constructions, so we are really used to work in any type of environment in that sense. I wanted to also mention that I find the work that Amber is presenting and showing like super interesting, because for us and for me particularly, that we are working with technology, we are very used to monitor things that are measurable, like how many, the level of pollution, the level of noise, everything can be measured with numbers, but understand the life quality of the citizens, the health expectancy, the possibility of getting anxious, depressed, all of that, being like a technological company, for us it's quite impressive. It's sometimes difficult to really see the impact of the actions that cities are implementing in the life of the citizens, and for me, like, truly it's eye-opening, I have to say.
Indeed,
Thank you.
I would tend to agree.
No, it's true.
I would also like to come back to. I remember now we previously had on this show. I think it was maybe episode 8 or 9. I forget exactly, but there was a professor. His name was Adrian Davis, I recall, and he was very much talking about health outcomes in relation to urban mobility. And I recall that his basic recommendation was to reduce speed limits to, I think it was 20 kilometers per hour or 30 kilometers per hour. He was saying that that single measure can really have a massive effect on health outcomes. And I'm talking also the positive health outcomes, not just the kind of less pollutant type health outcome. And now that I recall that, I would really love to hear you on that. And if your tools have been able to measure real effects of those kinds of policies, because we've talked about low emission zones, but I'd really like to hear you on the, let's say, 20K or 30K or some kind of very, very low speed limit that you may have tested out. I don't know who would like to go first. I don't know, Amber, maybe? I see you nodding a bit more.
Sure, I can comment. Yeah, I think reducing speed limits to 20K is well known as a very like one-stop shop, very, very quick measure that can have a huge impact on health. And what I wanted to add on this was that this year, with the funding and support of EIT Urban Mobility, we added an economic analysis module to our tool. So for some of the health indicators where there's sufficient data on the average costs of these health outcomes at a European level, and a percentage of which we can attribute those costs to the urban environment, you can now see if you're having a high impact on these health indicators, you get an estimate of how much you're going to save per person in healthcare costs. And I think the highest healthcare cost in that measure is road traffic accidents. So it's really, that's another way that introducing this lower speed limit can have a huge impact. It's very expensive for the health system, for lost productivity, and also just for individual trauma, of course. So yeah, and then also just to add that from our model and our system, the measure that always comes up as the most important element that has the impact on the widest number of health outcomes, and maybe it's not so easy to implement like a lower speed limit, is urban greening. It's always highlighted as the most important thing, because it also has an impact on mobility. It has a big impact on encouraging active mobility. If spaces are greener, people are encouraged to walk, they're encouraged to cycle, they have shade, they have protection from the elements, and just have that desire to spend more time outside. So yeah, just to add that as our own version of the 20-kilometer limit.
Okay, brilliant. And Claudia, any time that your tools somehow measured the effect of such a policy, like reducing speed to a much lower level in a city?
No, unfortunately, no. We are able to
Okay.
identify the type of vehicle and so on, but not the velocity of it. I
Okay.
mean, I will pass by. I will share that thought with the technicals, and but yeah, no, not for the moment.
Okay, but in any case, what I take from this conversation is that there are these two angles, reducing speed and reducing traffic, and especially then through greening urban spaces. That seems like two very big avenues for quick change, let's say. Brilliant. I would like then to finish, as we're getting to the end, with a final thought from the two of you. I mean, obviously, we're getting close to Christmas, so it's time to think a little bit about fairy tales and an ideal world where things are bright and happy, right? We're going into the festive season, so we might as well go head on. I'd like you to maybe try and draw for me in a very, like a quick thought, what the kind of ideal city looks like, where noise and air pollution are absolutely to the minimal. What kind of urban mobility is there in that ideal city that we have to build of tomorrow? Maybe Amber, you can go first.
Sure. So I think it's not far off where I live at the moment in central Barcelona, actually, because I live in a walkable neighborhood, which is almost entirely pedestrianized. So I can leave my house and walk down the street, and cars have the ability to access in an emergency or for occasional deliveries, which in this ideal Christmas wish list are all going to be on e-bikes on this kind of delivery system. But yeah, it's to be able to walk to everything you need within a 10-15 minute walk from your house, to be able to walk down streets that are pleasant, interesting. They have benches, trees, spaces to socialize. The quality of the ground is good. There's interesting things to look at. You're not bothered by traffic. You're encouraged and you're desired to do this. And there's also within 300 meters of your home access to a decent sized green space to relax, to socialize, to play, to let your dog off, and to connect you to other parts of the city. Large, well connected, well built, safe, separate bike lanes, as well as a variety of public transport options connecting you to where you need to go. Some light rail or tram or metro to connect you around the city, as well as within a reasonable distance of your house, a rail station for these long distance routes. But I think for me, the key thing as well is those connections to the other parts of the city and to the green spaces in the outskirts of the city that are larger and important for physical activity is really on the micro neighborhood scale. Not needing to leave. I don't need to go out of my neighborhood to shop, to spend time with my friends, to go to the doctors, to go to the pharmacy, to even go to work is within a walkable distance of my house. And I think all of that is what's going to create these improvements in physical and mental health and significant improvements in healthcare costs, because preventative healthcare is much cheaper than curing healthcare issues, and our environment is an essential first building block in ensuring people live healthy, happy lives free of pollution.
Wow. Okay. Thank you. Sounds like an invitation to come and live in Barcelona for anyone listening today. Okay. Brilliant. Thank you, Amber. Claudia, what would your city look like where there's no noise and air pollution?
I mean, I like the city that Amber drew, but again, yes, I think urban design should prioritize the well-being of the citizens. The center should belong to the pedestrians, and cars should only be limited to case of emergencies or of service cars. I think the 15-minute city needs to shift from a concept to a reality. Everything should be within a walking distance. And also, if it's not walkable, there should be public transportation that allows us to go to any part of the city quite quickly. For that, I think it's super important to make it frequent and reliable. People must, in order to make it their to incentivize the use of public transportation, we need to make it more reliable. If I want to use the public transport to get to work, to get to a doctor's appointment, I need to make sure it must ensure me that I will be there on time. I think it's also very, very important to make it adaptable and inclusive to everybody. We should not leave the neighborhoods outside the city without public transportation. We also need to make sure that they are also included in these 15-minute cities, and also they must be multimodal. If we are having cities with metro, tranvia, buses, and more, we need to make it accessible and easy to use. Each of them cannot have a different ticket or app. Everything, we need to get information about all of them, and we need to make them cohesive. So if I leave the house and I want to use the public transportation and I want to go somewhere in the city, I know that I will have different options, and that if I take the tram and then the bus 57, for example, I will get there. I think that's for me what it's needed.
Yeah, the inclusion as well, that mobility provides inclusion, and that's not just about moving. There is also an actual net health benefit in feeling part of a community, part of a city, and so that's also important. In addition to being able to move around, to feel a part of some kind of a broader community, and yeah. Brilliant. Thank you so much, Claudia, Amber, for having shared your insights. There are lots of comments also in the chat to thank you for all your preparation and for the work that you're doing. So good luck in developing your respective tools. And we will then be sharing also the presentations, the recording, so that people who would like to know more about the tools will be able to find that information. So thank you so much, Claudia and Amber.
No, thanks to you for having us.
Thank you. Thanks for having me.
Brilliant. So we will now finish with some final remarks. I will be joined then by Ana Burgues. She is Investment Associate at EIT Urban Mobility. Ana, we've been discussing various aspects related to noise and air pollution. It would be great to hear a couple of thoughts from you on maybe what you heard. And then, feel free to also share some information with our audience. So please, Ana, over to you.
Thanks a lot, Jean-Paul. So indeed, I was part of the whole conversation today, and I took a few notes. Before, I would like to point out I'm very passionate about urban planning, and I think these two tools that were introduced today are key factors in order to move forward with more livable cities. But as I was saying, for the wrap-up of today's mobility talk, I've taken some notes. So I will briefly read them, and then I will talk about one of the open opportunities that we have currently at EIT Urban Mobility. So to wrap up today's mobility talk, we've explored how better mobility planning can indeed reduce air and noise pollution while delivering broader benefits for citizens' health and quality of life. I'd say that one of the central themes throughout today has been the power of data. How tools like the ones introduced by today's panelists, Amber and Claudia, can identify pollution sources and guide sustainable targeted actions. The discussion as well has highlighted that tackling urban pollution isn't just about switching to public transport and removing cars in cities. We've seen this survey that was launched, and many of you responded, where that one of the main measures should be shifting indeed to public transport. But during the conversation today, we've seen that this needs to go beyond, and panelists agreed that this shift must go beyond the infrastructure. It requires understanding the specific needs of the city's population and ensuring solutions are tailored to their daily realities. And finally, another very important point, I would say, is the dual role of information. So this is not something that it's only needed for cities, but also for citizens to understand and embrace the benefits of these changes that are being done in cities, because these are improving mental health and reducing the costs of public health. So this has been my wrap up. We've also made this Christmas wish list from the two panelists, and I would say in short that what they are wishing for is having everything accessible in a nice and comfort way, and don't be bothered by pollution of any sort, and make the 15-minute city a reality and not just a project and something that everybody talks about. So besides the two tools that have been introduced today, I'm sure there are many more out there in the form of new innovations that are launched by startups all across Europe. So this is the reason why I'm bringing here to you our financial support to startups open call. This is a call, continuous call that we have at EIT Urban Mobility, and the next cutoff date will be closing early January. So what are we looking for? As I was saying, what we look for are products and services that are applicable to the urban mobility industry. Please think of it from a broader scope when talking about urban mobility. We need these solutions and products to have an innovative component with high scalability potential. We like diverse teams. Also, not only in terms of gender diversity, for instance, but that have complementary skill sets and that have the knowledge of the industry they are operating in. And finally, we give a lot of importance to the impact approach that the teams and the startups are giving to their products and solutions. If you feel you fit this profile and would like to learn more, there's also our investment thesis. So maybe if you are currently fundraising, you would like to understand what's in here for you. So we are targeting startups into series not only from seed stage, but also until Series A. We are targeting an equity stake from 5 to 10%. The maximum ticket size for this call is 2 million euros. This doesn't mean that the startups would get straightforward 2 million euros, but we will assess case by case. And your pre-money valuation at this time has no cap. So whatever your valuation is, as long as it is justified, is eligible to apply to the call. So very, very quickly on the deadline. This is closing on the 10th of January. So if anybody of you today in the call or you know anybody that fits the profile, please share this opportunity with them. We will be happy to analyze each case. And that's it from my side. Thanks.